Imagine you could step inside the minds of Canada's healthcare leaders, glimpse their greatest fears, strongest drivers, and what makes them tick. Welcome to Healthcare Changemakers, a podcast where we talk to leaders about the joys and challenges of driving change and working with partners to create the safest healthcare system.
Hey listeners, it's Philip from HIROC. Thank you for listening. Today, we've got two guests for you, Sonia Hsiung and Natasha Beaudin. But first, let me tell you how we got to know them. As you all know, HIROC has many partnerships right across the healthcare sector. We are truly grateful to each and every one of them as they help drive us forward, all with the goal of turning the corner on patient safety. And so we recently collaborated with one of those very partners, the Alliance for Healthier Communities. We asked their members at their annual conference to tell us about individuals making an impact in the community. In other words, changemakers. And we received many names. And we're delighted to share Sonia's and Natasha's story with you today. So listen up. Welcome. I'm happy to have you both on the show today. And let's just start off by I'm going to ask you both, tell us a bit about yourself and where you work.
Sure. Hi, Philip. I was actually trained as an electrical engineer. So I worked in the energy sector, what seems like a lifetime ago now. And that was soul sucking for me. So I went on to pursue more education and a career change into community development. And I worked in a number of different areas within the nonprofit sector, both internationally and then in Canada. And then I found myself in community health with the Alliance for Healthier Communities, with the prescription community social prescribing pilot back in 2018. I now work with the Canadian Red Cross to direct the Canadian Institute for Social Prescribing. And I still get to work with wonderful colleagues at the Alliance like Natasha and to continue learning from Alliance members.
Wow, that's quite a shift from electrical to what you do today. What got you into electrical in the beginning?
I think it was the thing that you do as an Asian immigrant child, and that was sort of the path that you take.
That's very true. I hear you. And Natasha, tell us a bit about yourself.
Well, if we're going to go way back, so my degree is a Bachelor of Fine Arts, and I started off doing art education, and I shifted over to health education and health promotion. So I worked for almost 20 years at a downtown community health center here in Ottawa as a health promoter. And I did all kinds of things like food security work, smoking cessation, exercise groups like our walking group, and all kinds of our stress reduction program. And then I was invited to lead a new project about social prescribing. So in addition to some of my health promotion work, I also led social prescribing, which got us started on all kinds of groups. In fact, some of the arts and culture groups. So some of my early work kind of came back into my health work. And then I was invited to take a secondment with the Alliance for Healthier Communities. And so I have been working with the Alliance for Healthier Communities for over a year now as the lead for social prescribing for our province-wide for our members.
Wow, very good. So it sounds like community is in your DNA, Natasha.
For sure.
And I'm happy you brought up social prescribing because that's kind of why we're here today. So can you both share how the social prescribing initiative got off the ground? What was the problem you were looking to solve?
So I can start here, Natasha. Feel free to jump in anytime. So in around 2018, the Alliance had an opportunity to apply for a one-time grant from the Ministry of Health for something innovative. And before 2018, the then executive director at Country Roads Community Health Center, Marty Crapper, had heard about this emerging social prescribing initiative in the UK that was putting in structured pathways to bridge clinical healthcare, social services, and informal community supports to address well-being and belonging. So Marty became quite excited for the potential for us to learn from this in Ontario. And then in the summer of 2018, Rexdale Community Health Center ran a localized social prescribing pilot that was focused on supporting families with very innovative, very interesting connections with arts and culture. So it was a very natural next step for Alliance to apply this one-time funding towards testing out what social prescribing could look like and how it could enhance the work of member organizations here in Ontario, which is how that prescription community pilot emerged. And there were 11 community health centers that were early adopters on that journey together, including Centertown Community Health Center, where Natasha was. Natasha, anything you want to add on that?
Well, I mean, I remember coming back from a parental leave and sort of saying, I'm not going to take on any big projects now. You know, I'm a parent. And my director saying, great, you're going to be the lead for this new project. And I went to Toronto and learned about social prescribing. And I can remember my first impression being, well, this is the work we're already doing at community health centers because of our comprehensive primary healthcare is team-based. We're already making a lot of these referrals to sometimes things that are non-clinical, but that support your health and well-being. And then on second thought, like as I worked more in this way of working, I saw how it improved our model in so many ways. So helped us really integrate our work, helped make those connections between the clinical side of things and our health promotion side and the social workers and the counselors. Really kind of provide that holistic care. So at first, I had to get my head around it. And then once I saw all the benefits, I was able to share those benefits with my colleagues. And then my colleagues started seeing the benefits of working in this way.
Very cool. And who supported you all on this journey?
Well, we had, to start with, lots of mentorship from colleagues in the UK. So we had folks from their National Health Service, we had physicians and others who had embarked on this work earlier to inform us about what they did and what they learned. But as Natasha said, it really was work that was already happening in community health centers and other Alliance members. And it was more around building a bit more of that intentionality, the structure pathway, the measurements within our system. So I would say the 11 pilot sites ended up supporting each other quite a bit. We met quite frequently. Natasha, I don't remember if it was monthly or...
Wasn't it daily?
It probably felt like daily. I know I was bothering Natasha all the time to learn. And there was just so much creativity within each center as well, where the teams ended up supporting each other. And Centertown had an awesome team with an awesome name.
Yeah. I always try to come up with good acronyms because we have a lot of committees. So I called it the SOHOT team, the Social Prescribing Horizontal Team. But I think the great thing about that team, having different members from across different departments in our large community health center, was we could ask the nurses, okay, how is this going to work best for you? How is the easiest way for you to send this referral? How can we communicate what programs exist? We could ask the physicians, we could ask the nurse practitioners, we could ask our outreach workers. We had our health analyst on that team. We had our data management coordinator. So it was like an opportunity for us to share each of our perspectives and how we could really improve our collaborations as a team and make the whole center more efficient.
I love that. And it sounds like communications at the core, which is very critical to any initiative, getting off the ground and being successful. And so with that, what has the impact looked like thus far with this initiative? And what feedback have you received from the community?
Well, I can talk a little bit about Centertown, what I saw. So sometimes I felt like my primary care colleagues would be like, well, I'll send you down the hall to Natasha's yoga program. And they weren't always sure. Sometimes I felt like there wasn't always confidence that some of our health promotion programs really fit into healthcare sometimes. Sometimes I felt that way. But as Sonia mentioned earlier, being able to track those referrals instead of just saying, oh, just go down the hall. I verbally told the client, but it wasn't. But what we did with social prescribing is we tracked it through our EMR. we had that referral on the client's file, and then we could say, oh, did they end up attending that group? And then what I started seeing happen was my colleagues in primary care, so physicians would say, I was really dreading that checkup with that client this morning because they're so anxious and it's hard to actually get through the checkup. But they've been doing that stress reduction program now for 6 months, and I saw a change in how our checkup went. We were able to get through it. I was able to really get to what matters to the client because we I heard things like that, or I heard we started a coffee drop-in as just an easy way for some of our clients who were quite isolated and quite fearful from joining groups. And then I would hear from my physician colleagues, since, they brought it up in their appointment that they enjoyed this coffee club and that they've made some social connections. And just the mere fact that the client brought it up in that limited time we have together tells me how much they value it and what an impact it had on them. And then I guess I'll say one more quick thing is we flagged 50 clients who were frequent users of primary care and who also had NCODEs associated with low-level anxiety, low-level depression, loneliness, isolation. And we sort of targeted them for our social prescribing. And what we saw by the end of our 9 months was that their primary care visits decreased by 50%. So that's like a nice concrete piece of evidence where we can say, yes, if clients are going to meet with their doctor or their nurse practitioner every week and talking about feeling lonely, there's limited ways that a clinician can respond to that. But there's these other non-clinical supports that can help that client with some of those needs.
And it's very timely you bring that up, Natasha, because I'm sure everyone's been watching watches the news and hears all about the variety of reports, and the epidemic of loneliness is quite prevalent, and not just in certain centers but everywhere. So I do. I know our listeners appreciate you bringing that point up as well. And yes, Sonia, please add as well.
Yeah, there was just so many fantastic stories that came out from all of the different pilot sites. And as Natasha said, that ability to track the outcomes was just powerful. We saw an overall, on the topic of loneliness, we saw an overall decrease in people's sense of loneliness by 49%. And that is huge. That was over just a 9-month period. And people reported better mental health, better sense of connection to their community. And what was really important, that as an outcome of this pathway, is that people said they felt that they were seen and heard as whole persons even when they were in their clinical appointments. And that made such a shift in people's sense of self-confidence, their sense of purpose, their sense of, yes, I can manage my own health and I have the ability and capacity to do it in this way. Another thing that we haven't mentioned was that there was a big push towards co-creation in the social prescribing pathway, and how it was implemented at Alliance Centers was that clients are people who also have gifts to contribute, and that they were invited to contribute their gift in their communities. And that was also where we saw a very significant shift in seeing people as health creators and not just users of the healthcare system. So that's the sort of personal and community impact. But there's also this continued ripple effect of the success of the pilot having inspired a lot of organizations and communities right across Canada and internationally. So we received the first award for an international project from the Social Prescribing Network in the UK because of the strong equity lens that Alliance members apply to their initiatives. And Centretown hosted a learning delegation from Singapore for, Natasha, was it 6 weeks, 8 weeks?
Yeah, something like that. Yeah, they came to learn both about social prescribing and about the model of community health centers to bring that back to their community and to their healthcare system.
It's really wonderful. And that was a time-limited pilot that ended in 2020, right before the whole system's attention shifted towards the pandemic. But we are continuing to see, and we have continued to see, interest from different communities and also funders to continue building out and expand on this work and expand on the impact.
No, it's very good. And speaking of that impact, what's next for you both and, even this initiative?
Yeah, just say that with the funder interest, there was at least 3 different social prescribing programs that emerged from that Natasha is now leading and deepening and making happen. So Natasha, do you want to speak to those?
Sure. So in 2021, we launched a 3-year project called Links to Wellbeing, which is a partnership with the Older Adult Centres Association of Ontario. And that's helping to connect socially isolated older adults with seniors active living centers across Ontario. And we are still recruiting health partners for that project. So if anyone's interested, feel free to get in touch. In the fall, about a year ago, we started the Black Focus Social Prescribing. So with this project, we're working with 4 community health centers to develop a social prescribing model that is grounded in Black and Afrocentric values and principles with a focus on supporting families and children. So we're asking, how can we make social prescribing culturally safe and decolonize aspects of the healthcare system to improve health outcomes for Black people in Ontario? So that one has been quite exciting and interesting to work on. And in the fall, our 3rd project, we launched Social Prescribing for Better Mental Health, which is funded by the Public Health Agency of Canada. And we're working with 28 sites to improve social prescribing pathways and developing resources and tools. And we have also started an online learning module on social prescribing, which will be widely available in November.
Wow, I think every point you brought up, I was like, this is amazing. Like there's so much momentum and the word possibility came to mind. And so, thinking of those 2 things, where do you both draw your inspiration and motivation from to keep this impact, this movement moving?
I think for me, on a personal level, my mother was an immigrant to Canada and as a single mother, and I was old enough to have seen how difficult it was to settle in a new place, build connections, find job, find housing. And the one thing she did find was a primary care provider. And I just think how amazing and how much easier her journey would have been if we had this interconnected network across the board. And I'm also continually inspired and just pushed by the other passionate change makers that I have the privilege of working with, like Natasha. And I think that passion begets passion, and it really helps to drive what we do forward because there are challenges, there are mistakes, there are failures, and it's wonderful to have a community around where we can support each other.
I think Sonia and I work very well together. And even I have some new colleagues, and I sort of said, okay, once you start working with social prescribing, you don't have to work hard to get the enthusiasm up. The people who are interested in this bring a lot of enthusiasm and they bring a lot of passion. I mean, if I feel like I do draw, like having worked at a community health center, a downtown community health center for many years, I really saw the strength of our community members and our clients and how a lot of those folks faced just challenges that you would be really surprised to know exist in a wealthy country like Canada, in a wealthy city like Ottawa. So people living in poverty, living like with challenges with their housing, with accessing food, with accessing equity on many, many different levels. And then seeing those people work hard on their goals and triumph, like there is nothing comparable to watching that in terms of inspiration. And even earlier when Sonia mentioned that role where the clients could step in and volunteer, that's where I saw some amazing strengths come out. We started a creative writing group and we had peer leaders trained, and seeing people step into a role, people who maybe were on long-term disability or had different reasons for not being able to step into the workforce fully, but they could take on a role and take on some leadership, and seeing that client blossom with those opportunities, that was very impactful.
Most definitely. And so, this story you've both painted sounds fantastic. I'm definitely, I'm encouraged and I'm motivated. But what if there are one or two pieces, or even three pieces of advice you can share with our listeners right now, if they wanted to start something like this or partner with you both or one of your organizations to do something like this? What would that advice be?
I think something that I always say is that you can start small. I always start with a pilot. I always start small. I test things out and then slowly build as I go. There's some really easy referrals that exist for social prescribing, like 211, Ontario Caregivers Organization, the Seniors Active Living Centers through the Older Adult Center Association of Ontario, or even my physician colleague at Centertown, Dr. Kent, um, shared that she had a client who was expressing feelings isolation, and they started. So, the doctor asked a few questions. What did you used to like to do? How did you connect before? Oh, we always used to have dogs. And, the client got a dog, and then through walking the dog, like made some social connections and needed a dog sitter when she went away. And then the client also expressed that she used to go to church. And so the doctor said, well, could you connect with another church again? And the client started going to church and joined the choir and, found community in those ways. And then when something very difficult happened in that client's life, she had a community that surrounded her. People said, oh, I didn't see you walking your dog, so I just dropped by to check in on you. Or you weren't at choir practice for a couple of weeks, so how are you doing? So it doesn't have to be complicated. It can be just simple, community connections. And it just means asking one or two extra questions with your client.
That's awesome, Natasha. To add on to that, and I think as the undertone also of what you've been saying, is collaborate. Collaborate, collaborate, collaborate. I think part of how this work has been so successful is that it is everyone sees themselves in the pathway. Everyone can see themselves as a contributor, as a recipient, as someone who is a connector, someone who knows someone who needs to be connected. And this is around collaborating within the health teams, between the health teams and the community, between practitioners, and also at the systems level. And so to me, that is a really huge part of how we can continue the momentum in this work. And a part of what we're doing at the Canadian Institute for Social Prescribing now is for us to be able to collaborate across provinces, across regions, bringing in leaders like Natasha and others who can help build build a foundation for this work across Canada and advance this knowledge and awareness and changing the culture of our healthcare system towards connection and towards belonging.
I love that. And it's such a great, just hearing about this initiative and hearing the impact it has is, like I said, it's definitely warmed me up. But, you know, we got to learn about you both, and you, Sonia, first from your colleague, Kate. We had put out a call out to all the Alliance members about people who are change makers, and she talked very highly of you, Sonia. Told us your story, and we're like, we have to have you on our podcast, our leadership podcast, because you bring such you bring such a unique lens, and the things you're doing is making huge impact. And then you introduced us to Natasha. And so all this to say that you both are definitely change makers in the sector, but you are both individuals who want to share knowledge across the sector so that others can scale these learnings to ensure that the system keeps moving, that people are connected, that community is thriving. And so I just want to congratulate you both on being amazing change makers. We appreciate you.
Aw, thank you so much.
Thank you.
And I thought I'd end off with a few lightning round questions to ask you both. And so, do both of you have any piece, like a motto you live by?
So when I worked at the health center, I used to have this kind of way to start my day to ground myself. And I had some guiding words, and it would be like compassion, centeredness, groundedness, and confidence. Those would be my 4 words I would often start my day with before I met with clients.
No, I love that.
I don't think I can top what Natasha said. That was brilliant.
What's one thing you both are either reading or watching right now that you're just like, I'm so happy this is in my life?
I love Ted Lasso, is my favorite TV show.
Love it.
I also read this great book recently that was quite inspirational called I Will Live for Both of Us, a story of Inuit resistance by Joni Scott. And it's about a small group of Inuit in a small town called Baker Lake and how they resisted uranium mining. Like they organized and were able to resist a huge mining company and the Canadian government to prevent uranium mining in their community. It was very inspirational.
Yesterday, I was at a fantastic workshop with Cormac Russell. And for those of you who might not know him, Cormac Russell is a wealth of knowledge and expert in asset-based community development. And he has a book called The Connected Community, Discovering the Health, Wealth, and Power of Neighborhoods, and just really fantastic. And I would encourage everyone to listen to him. I think you can find him on YouTube or read the book. It was just a beautiful way of recentering and regrounding the work that I do in community and in what matters and in the gifts of the people.
Very cool. If you both had to deliver separately, I had to deliver a 40-minute presentation without any preparation whatsoever, no preparation. But you had to give a presentation on whatever this is, something that obviously I'm assuming it'll be something that means a lot to you, that you can easily give. What topic or what would that presentation be about?
I would talk about food. I think I can free flow 40 minutes on food.
I'd love to do a presentation on my garden. I don't know if there'd be a great audience for that, but I have a small little urban garden that I love.
I love it. Do you have food in your garden, Natasha?
We have grapes, we have raspberries, we have lots of veggies, and I just kind of mix the flowers and the veggies all together. So it's very small space, but a lot happening.
Oh, that's even better. Well, we're so happy we had this time to chat with you both, and just the fact that you won, that you were nominated as changemakers, and the fact that I could definitely see you both as changemakers is an amazing accomplishment. We in the healthcare community, salute you, and what most importantly, I'm just so grateful you're part of the community and you're giving back in this way as well now by sharing your story. So I really appreciate that. So thank you, Sonia. Thank you, Natasha.
Thank you.
Thank you so much for having us.
Thank you for listening. You can hear more episodes of Healthcare Changemakers on our website, HIROC.com, and on your favorite podcasting apps. If you like what you hear, please rate us or post a review. Healthcare Changemakers is recorded by HIROC's communications and marketing team and produced by Podfly Productions. Follow us on Twitter at HIROC Group or email us at communications@hiroc.com. We'd love to hear from you.